Welcome to 35 Days to Good Health.
Good morning, ladies. It is good to see both of you here this morning. My name is Bernard Beal, and I'm your host of the podcast series Life at Its Best. But we have taken a very special turn in our podcast series. We are focusing our series on what we call Black and Blue. And we're talking to and interviewing people in this year-long series of people who are living a good life that are Black people, people who have a tremendously long life style, history, and longevity. And we want to tell their stories. So I have two experts with me today, Patty Heron, who is professor at Loma Linda University, and she is also an investigator of the Adventist Health Study, and she's my co-host as we move on this wonderful journey. And I'm so excited that we're having a special conversation today with Dr. Christine Ince, who is an oncologist, a medical oncologist who actually helps to heal people through modern medicine to help to improve their health if they're especially caught in with this terrible disease of cancer. And Dr. Ince, we'll hear more from her today, but I would like to welcome both of you here with us this morning. We're going to talk a little bit more specifically with you, Patty, this morning as well, but good to have you both with us this morning.
It's wonderful to be here, Bernard.
Excellent.
And have a great day.
Excellent. And Christine.
Thank you. I appreciate it.
Yes. Now we have so much to talk about because as we're helping, what we're doing is we're trying to treasure, we're trying to save this knowledge of people who are Black, which, today there's a lot of stuff that's going on, and Black people aren't getting necessarily the best of press. So we want to show that there's more out here than what is being shown in the media. We have this set of people who we think are so special. We believe they represent probably the longest living people in the world. And so we're focusing on their story, and we're focused on this little area that we will talk about in our future podcast. But Dr. Heron, you are an investigator of the noted Adventist Health Study. Now, this study was sponsored by the National Institute of Health. Did I get that right?
Yes, and the Cancer Institute. Yes.
Yes, and it is considered one of the blue ribbon health studies. And you are the investigator that works primarily with the African American population and some of the other minority groups as well. Did I get that right?
Yes, I worked to recruit primarily the Black Adventists. Yes.
Beautiful. Now, Patty, we want to know more about the Adventist Health Study because we want to share it with both our listeners and our viewers so that they can begin to understand. If you want to live a good life, you need to start thinking about what you're eating, what you're drinking, and how you're doing all of these things. And now we have these studies that prove out all of the things that we've been saying, and we have the treasures of these people who are living these long lives. But can you tell us about the Adventist Health Study and share with us information that you have about the study that will give us confidence in what we're talking about here?
Okay, let me share my screen and let me show you. Can you see my screen?
I see it.
Okay,
Beautiful.
let
Go
me give
right
you
ahead.
let me give you an overview of the history of the Adventist Health Study. We have been studying the health of Adventists for over 60 years. And it started back in the 1950s. And in the 1950s, it was called the Adventist Mortality Study. And it started in 1958 and it went through to 1966. Now, the significant thing about this is these subjects were California white Adventists. And so again, we studied them for a number of years. The second leg of the study was called the Adventist Health Study 1, and it started in 1974 and went through 1988 for nearly 10 years. And during this study, we confirmed a lot of things that we found during the Adventist mortality study. And again, I want to emphasize that the subjects were white California Adventists. All right. Now, the studies that you see on top here, these are co-studies, sub-studies that, and we are the parent. There's an air pollution and also a religion and health study. The Adventist Health Study 2 is what we're under today. And this is where I came on board. I came on board because, like I mentioned, our data that during this study, Adventist Health Study 1, where they discovered that white Adventist health was very superior and that Adventists lived, between 7 to 12 years longer than the general population. It was based on the Adventist Health Study 1 data of California white Adventists. We did not have much participation from Black Adventists. And when I came on board, that was my chief role with my research team, was to motivate Black Adventists to become a part of the study. So we recruited between 2002 and 2007. We recruited. The study is going on today. And during this time, we recruited 97,000 Adventists. Of the 97,000 Adventists, 48,000 consented to be a part of the study, which meant that they agreed and they were convinced that it was so important that they would put aside their distrust and their mistrust of research and to want to be a part of the study. And they took the survey home. But of the 48,000, 26,000, a little bit over 26,000 returned the survey. So right now, of the 97,000, we have 26,000 that are Black Adventists. And we are in the process right now of analyzing this data, very valuable data. And it's one of the largest studies in the country with such a large population of Blacks. That's why it's so important.
Now, let's talk about a little bit about what makes Seventh-day Adventist Christians a special group. They are very much focused on diet and lifestyle. And so you're saying that we have a set of people that are African Americans that are living a lifestyle contributing to their long health. And by the way, that's how we found these people who are, as we say, living in zone, people who are 90 to 100. And we have found this group of Black African American people who are living, into their hundreds. And it's crazy because it just doesn't make sense. They're living a beautiful life all the way in those many years. And so what you're telling me is that those studies started with white people, and then when you came on board, you brought on the Blacks, and now we're proving through your study that the data says that whether you are Black or white, and by the way, any other color, any other persuasion, if you live this lifestyle, your likelihood of being able to make it to 90 and 100 is much greater. Did I get that right?
Yes, what's so remarkable about the study is that when we added the Blacks to the study, the oldest subjects of the 97,000 were Blacks.
Wow.
Yes.
That's a good one.
Yes, that's a good one. And you already have found the 104, a couple that are 104 right now that you want to interview.
Yes,
So
as a matter of fact, we had Mrs. Wright on the other day. She's married to to Dr. Rogers, and she's 102 and he's 104.
yes, yes. So
And
it's
he's up next week, by the way. We're interviewing him next week, but go
good,
ahead.
good. So, because that Adventists live longer and Adventists are part of the blue zone, along with Japan and Italy and etc., it's based on white California Adventist data. But now we have data to support that Blacks live longer too. We
Boy,
have that data now. We don't have to guess because we're Adventists and, across the board, we live longer, we have less diseases, blah, blah, blah. We have the data to support that.
boy, that's good news. And by the way, let me throw in a biblical principle. The Bible, and this is what Adventists believe. They believe the Bible, the both ends of the Bible, the Old Testament, New Testament, and so on. And the Bible says that if you do these things, I will give you long life, and I will also make it so that you will have a good quality of life. So these people are actually proving the Bible to be true. Is that right too?
And Adventism, we're based on our health message. The right arm of the gospel is our health message. And so
Wow.
now we have data to support that it is. And I want to add this last leg of the study, Adventist Health Study 2. It is a cancer study. We're looking at 3 cancers. We're looking at breast cancer, prostate cancer, and colon cancer.
Wow.
But even though it's cancer, our aims are cancer, we can look at a hodgepodge, morbidity, mortality, all kinds of things that we've done in the past because we have the data to look at those relationships.
That is marvelous. Now, Christine, I want to bring you in. Dr. Ince is a medical oncologist, as I mentioned, and she has been practicing medicine for decades, and she recently um, decided to put her practice uh, away for her, and then she decided to move on to do some other things. So some people would call that retirement, but I call that retreading. So what you're doing, Dr. Ince, is you're retreading. Now, as you're retreading, you have some time now. When you are a practicing physician, your time, and I know because you and I have known each other, full disclosure, for probably 30 years, which would be half of your lifetime and my lifetime. We've known each other for many years. And uh, I know for a fact that if I call you, you're my personal friend, I may not get a call for a couple of days because you're so busy. You're trying to save people's lives. You're involved with a lot of amazing things, but now you're starting to move to a point where you're able to look back and you're able to about what you were in with, and you can pull all these things together. You dealt with patients through imaging, nuclear medicine, and all of these things that people have to deal with when they have cancer. So you are right there. You were right there on the front lines, and you're just stepping away from the front lines. So I think that this is a wonderful privilege to have you on to the program. Before we start, I've got 100 questions, and I know, Patty, you probably have some questions too. Is there anything you want to start out with before we get going on our questions for you, Dr. Ince?
Well, Bernard, first of all, I want to thank you and Angela for being a part of our lives. About 13 or so years ago, my husband developed an advanced case of lung cancer. And he was a non-smoker, and we were vegetarians. But looking back, I considered us unhealthy vegetarians, if there's such a thing. So you and Angela, at our invitation, came to our small community in central Louisiana and gave over a week-long healthy lifestyle education class. Bernard, those classes literally changed our lives. And I want to thank you for that. I now consider us a little bit healthier vegetarians.
Boy, Christine, I can tell you, you're kind of choking me up there.
Well, I was trying not to get any water in my eyes as well, as I was telling you. I mean, literally, you have no idea how many times I have quoted you and Angela. It's more than even my mother.
Wow. We
About the healthy lifestyle, because my mother was a vegetarian. That's another story. She became a vegetarian 2 years before we were born. And she and my father would credit their becoming Seventh-day Adventist vegetarians with our even being able to be born, because he was considered infertile before that.
Man, I mean, that really brings up so much. I mean, Christine, this is just amazing. And for you to say that, my wife and I we just feel like all we've done is collected this information and just share it with people. And then we've lived it ourselves. And at my age, I'm not supposed to be doing the things that I do, but I do it with joy. I have such a good life. But you mentioned something there. You mentioned that your husband actually, even though he was practicing a healthier lifestyle than the average person, he still got the cancer, which goes to show you and to say there are a lot of reasons why people can get these diseases. It may come from the environment, it may come from something that they encountered, or somehow in the genes that got passed down. But what is most distinct to me is that when your husband got that cancer, he became a survivor. And if I remember correctly from the conversations that we had, you have mentioned that the doctors who are not Adventist doctors mentioned that his lifestyle helped to contribute to his ability to defeat the disease. Did I get that right?
Oh, absolutely, absolutely. If he were a smoker, had severe COPD, and he couldn't spring up onto the exam table, they would not have recommended such a aggressive form of treatment in getting rid of the cancer permanently and long term. Praise God.
So there's the answer. There's the answer. You want to have the better lifestyle before you even get sick. And if you get sick, pray to the Lord and ask the Lord to give you everything that you need to help you overcome it. And that's why this extra knowledge is so wonderful. Now, I want to get into some for you, and also Patty, please help me with these questions, because I see this intersection between you as a studier and Dr. Ince being on the front lines. Dr. Ince, tell us a little bit about the whole process. A person gets cancer, and what's going to happen? How are they going to how do you get involved? And what is their likelihood of making it out of these conditions? And Patty, please come in here anytime.
Well, I'm a medical oncologist, a cancer doctor. And by the time the patient gets to see me, they've probably already seen a surgeon as well as their primary care physician. And they've had a biopsy, and they've been told for the most part that they have cancer. And so then they come to me, and we get to know the patient, find out what other illnesses they have. Like you said, Bernard, if they have a long list of illnesses, it's harder for them to tolerate the treatment, and the outcomes are not as good. If they are smokers, we recommend that they stop smoking. Smoking is still considered the #1 cause of preventable cancer worldwide. So we still strongly recommend that you stop smoking. Some of our, unfortunately, some of our Seventh-day Adventists are closet smokers. So I think it's important to discuss about preventing cancer by not starting.
Wow. Okay.
There are, and we go from there. There have been a lot of new advances in the treatment of cancer. So I always like to present hope.
Now, Patty, from the Adventist Health Study point of view, can you corroborate what Dr. Ince is saying here? Is this what you're seeing in the study?
I can't say that because we have not analyzed that data to look at that, whether or not people that contract cancer and their lifestyle is a contributing factor to them, beating the cancer and becoming cancer free. I don't know. I don't know that. I have to look at the
What
data.
What can you say about longevity so far as the studies are concerned?
Anecdotally, I have heard about several members of the study who have had cancer and who've had cancer 2 or 3 times and are still alive. I haven't looked and see if they're still alive today, but a few years ago, were still alive after beating cancer 2 or 3 times. And they're still in their 90s or 80s or whatever. So, that's something that would make a wonderful study to look at those who've had cancer and
Yes.
gone through treatment and to see in terms of their path from then on, in terms of their health,
Yes.
and whether they contract cancer again, another kind or whatever, and they beat that as well, and then go on and live, a healthier life after that. So it'll be interesting to look at that and extrapolate that data out and to look at those, just a few of them. That would make a very interesting study.
Excellent. Now, Dr. Ince, tell us, why is cancer so deadly? And what are some of the common cancers that Black people are suffering from today?
Well, cancer is basically tissue in the body that keeps growing and doesn't have, the brakes have been taken off of the normal death of the blood cells, the cells. And so they develop a form of immortality. And so that's what cancer is. And so it can nudge out the good cells and can cause death a number of different ways. Most common cancers in Blacks are some of the same cancers that affect the rest of the nation. Lung cancer is still #1, and then we have colon cancer, breast cancer, prostate cancer. Those are the most common cancers in the United States.
So if I want to make this really very real to you, if I get cancer, what is the most common cancer that you treat, especially among Black people? Now, I'm talking about Black people that may not be Seventh-day Adventists, that are not living that healthy lifestyle that may give them more resistance against those diseases. So what are the common things that you encountered in your practice amongst Black people?
It would be the same cancers: the lung cancer, breast cancer in women, prostate cancer in men, colon cancer in both men and women. Mm-hmm.
So let's talk about the men. I'm biased. What about the men? When the men get prostate cancer and lung cancer and whatever those conditions are, what's your go-to treatment methodology? And what does it do to the individual?
So for lung cancer, the preferred treatment is surgery. For people who smoke cigarettes, we're actually heavy smokers. We're actually recommending screening CAT scans to try to catch the cancer at an earlier stage. So if the lung cancer is at an earlier stage, like stage 1 or 2, then we recommend surgery. For prostate cancer, there's a wide range of treatments, ranging from watchful waiting. So a gentleman can be told that they have prostate cancer, but it's a low grade or a slow growing cancer. And so one option may actually be to watch it. Unfortunately, most of the time it's caught at a little bit more advanced stage. And then, a lot of this conversation for prostate cancer is carried out with the urologist about the choices that they have, ranging from surgery to radiation, or even at advanced stage.
Mm-hmm. Mm-hmm.
Dr. Ince, do you see, or has it been your experience to observe that physicians give Black men different recommendations for, let's say, for screening for prostate cancer?
Yes, so the American Cancer Society, the screening for prostate cancer has been a little controversial, because at one point in the past few years, they were saying that the PSAs were not that helpful. But there seems to be a consensus that for American.
Please expand on that PSA thing, because the average person may not understand the PSA thing.
I'm sorry, a PSA is a blood work that you can get to screen for prostate cancer. And there's a normal range depending on how old you are. So for instance, if you have a PSA of greater than 4, you probably would be referred to a urologist for further evaluation. So, but there is a general consensus that if you are at higher risk for developing aggressive prostate cancer, like in being an African American, that is considered a higher risk, then screening for prostate cancer is a definite option at an earlier age, at age 45.
So here's a note to all of our.
After discussing the pros and cons of screening, with your physician, which is usually actually the urologist.
Right. So here's a note to our listeners: male Black men, you're 45 and above, it's probably time that you start for sure focusing on, some of these screenings.
Or having that conversation with your doctor.
Yeah, so that you can get ahead of this, because you don't want to be farther down, because you do have effective treatments for many of these conditions, yes?
Oh, yes. And prostate cancer, believe it or not, is considered highly curable, or at least the long-term survival is, it's a high 5-year survival rate.
Right. Okay. Now, go ahead, Patty.
One of my students did the study in San Bernardino, and she found that white physicians did not encourage their Black patients to screen early for prostate cancer, whereas for their white men, the physicians recommended that they be screened early. In other words, they weren't treated the same. They were not given the same
Okay,
advice.
that's a good point, Patty. So there have been a lot of studies that have shown that African American men don't do as well with prostate cancer, as well as a number of other cancers. But when you find a place where the patients are treated pretty much exactly the same, their outcomes are the same, if not only the same, but possibly better in the case of prostate cancer. There's one study from the VA, and it seems like the VA has several studies that have shown that equal treatment, you will get equal outcomes.
That is
Yeah.
very encouraging. Very encouraging.
It's encouraging.
I can share that article with you after the Zoom meeting.
Please.
It's very encouraging if the physicians treated the Black men like they do the white men.
Yes.
You know, if they recommend and treat them, the same.
Yes.
Well, I'm not sure, what goes into the different treatment, but I do know even in children's cancer, where a lot of children get treated at the same institutions, so they're getting the same treatment, Black and white, then you have equal outcomes.
Mm-hmm. Very good. Very good. Now, let's talk about this. Patty, your study has a lot of information about cancer and about mortality. Even the previous Adventist health study that may have been the foundation of the information in your going forward here, what are you seeing or has been revealed about mortality, cancer, lifestyle, all of those three things kind of in the mix? What is the trend that has been revealed in these studies?
I wish I could tell you, like I said, we have not analyzed a lot of the data. So that, they need to look at that, but I really can't tell you. And like I said, of the 20, 30 studies that have been published already, there may be something in there to answer that question, Bernard. But
okay, well, let me tell you what I was leading to. I was leading to the Adventist Health Study 1, where they highly publicized the fact that lifestyle was pretty much a contributor to longevity.
oh, absolutely, absolutely.
That's really
No
the point that I was bringing out. Go ahead.
No doubt. And again, the latest study has supported that.
Right.
Has supported that.
Now, Dr. Ince, I want to ask you about some other chronic conditions, because do you see anything about people that have cancer that also may have some of these other conditions like diabetes, high blood pressure? Is there any kind of connection that you're seeing on the ground as you're working with people as well?
Oh, okay. So connection with chronic diseases and
Comorbidities is what I mean.
and then how they fare with their treatment.
Yes.
Oh, okay. So our patients often require chemotherapy, and chemotherapy has side effects, and it's much better tolerated the healthier you are to start off with. So if you have diabetes, that could make the treatment harder to give. If you have high blood pressure, that could make the treatment harder to give. And certainly if you have problems with COPD from smoking, you're at increased risk for developing pneumonias and being admitted to the hospital. So yes, the healthier you are, the better it is when it comes to your survival.
Now, that brings us to, I wish
Prevention.
we had more time. I wish we really had more time because there's so much more we could get to. But now we've got to get to what we're dealing with today, the issue of COVID. And I am so excited that you are in your transition to retreading, that you're taking a very active role in dealing with the COVID initiative. Would you share with us a little bit about that? And then I've got some more questions for you there.
Okay. Well, I'm a medical oncologist. Can I say something about viruses causing
Oh,
cancer?
you are free to say anything you'd like. Just go for it.
Okay. So we know about smoking and about alcohol and different things that can contribute to cancer, red meat, but we don't talk about too much of viruses contributing to cancer.
Mm,
Hepatitis B, C, H. pylori is not a virus, it's a bacteria in your stomach, increased risk of gastric cancer. HPV, the virus that causes cervical cancer, as well as a lot of other cancers. So these different viruses, we actually have most of them, we have vaccines to help prevent the virus, and in turn will help get rid of the epidemic that we have, for instance, with cervical cancer. So that I think is a nice segue to
okay.
to COVID-19, which is a
Yes,
virus,
but you know
a death
what?
virus.
It reminded me that I was biased and I was asking you about the men's health, but I've got to get back to the ladies' health because ladies have also these issues with cancer. So before we get to COVID, just give us a little rundown for the ladies with the special cancers related to the ladies as well.
Breast cancer, it can run in your family, so that's important to know. Be aware of that, and we don't recommend, like we used to, the monthly self breast exam, but it's important to know your breast and see if there's any difference that you need to notify your physician about. We recommend avoiding alcohol. Alcohol, even 3 or 4 drinks a week, will increase your risk of breast cancer. So, and then cervical cancer, we just talked about. I think it's real important to vaccinate your children, your adolescents, to help prevent the HPV and cervical cancer, and way down the road, other cancers.
Wow, very good. Okay, we're going to get back to COVID, and before we end, we're going to also just do a rollover of all of the advantages to lifestyle and what it brings to the table. So now, with your involvement with COVID, tell us about the campaign that you're working with right now. You all just had a successful venture. Share that with us as well.
Yes, we some former college classmates, physicians, were concerned about a lot of what I call misinformation. I'm finished with using the truth about this or that, because everyone feels like they have the truth. So I'm going to stop using that word. So I haven't figured out what to use in its place. But we had a wonderful webinar yesterday. We maxed out at 500. We were only allowed to have 500, and the goal of the seminar was to discuss the pros and cons of the new vaccines that are currently available in the United States. And so that's what we did. And I thought that that would have been one of the major obstacles to our people, African Americans, accepting vaccines. I felt one of the major obstacles would be lack of information from a trusted source. But I'm beginning to think that the major obstacle to us receiving these vaccines is the distribution process. That's what I'm thinking the problem is right now. So.
Wow. Now, you had experts onto the call, so your colleagues from all around the country, virtually around the country, and you fielded, what did you all accomplish in that seminar, that webinar?
Well, we talked a little bit about how vaccines work. And we had an infectious disease doctor expert from Tulane University and another one from Morehouse School of Medicine, as well as other physicians around the country. And so we talked about the new mRNA vaccines, 2 of them, the Pfizer, Moderna, as well as a third one, the AstraZeneca. We tried to answer as many questions. Unfortunately, we were not able to get to just a fraction. There were over 100 questions that were written in the Q&A section. So I believe that our people are really interested in getting correct information.
So
as far as healthy lifestyle, we strongly continue to recommend that as a way to deal with the disease and to keep our immune system as strong as possible. Same recommendations that we're talking about, today.
wow. Okay. So before I leave COVID, I'm going to go right to that lifestyle thing. But before I leave COVID, I want to ask you,
Mhm.
should I get a vaccination? Yes or no?
Yes.
For COVID. I'm talking about for COVID. There's a lot of people
I'm
running.
talking for you personally, yes.
Okay.
Asking for you.
Should other Black Americans get the vaccination? Yes or no?
For the majority of people, I would say yes. It's per CDC guidelines. It's not for children, if you are concerned about being really, really old and frail and bedridden and on hospice, then you definitely should discuss it with your physician before taking any of the vaccines. So.
Thank you so much. Okay.
And the main contraindication is if you're allergic to anything, right? Allergy.
If you're allergic to any of the products that are in the vaccines.
Okay.
And it's a very limited number of products in the vaccines. Now,
So what are the common things that I would be allergic to with respect to the COVID vaccine that I should remember?
There are no common ingredients. One is called pegylated, pegylated, that I'm not sure where that's available. But so if you have a history of severe anaphylaxis where you have to carry an EpiPen for shellfish or whatever, you can discuss it with your physician. And I would, recommend that you get the vaccine, if you're going to get the vaccine in a facility that, is able to monitor you afterwards.
Exactly.
That's pretty good. That's pretty good. This has been magnificent. Okay, now we're going to end on that lifestyle.
Yes, I had the Pfizer vaccine myself. Second one was on Monday.
And how did it go for you? How did it go for you? How did you feel with it?
Okay, so I need to tell you my story of my healthy lifestyle. I haven't had the flu or an illness that prevented me from going to work in over 35 years, with the exception, I think, 2 days in 35 years.
What?
So
Now,
I'm not
what
used to
are you? What are you now? And we have all of these different categories.
I'm following.
Okay, here are the categories that we have. We have, if you want to follow this lifestyle.
Okay, but no, but I can't go into everything because all of it is not proven. And some of it is from you and your wife's advice. For instance, like hot shower followed by cold shower. I cannot find that anywhere written in the medical books. So I'm not going to talk about that.
I won't ask you to talk about our little special things that we do. Those are things that actually, believe it or not, they came out of studies that were done by Dr. Kellogg many years ago, and he has scientific research, so it is scientific based. We don't present anything that's not evidence science based. And Dr. Kellogg, in his research years and years ago, back before the turn of the 20th century, during the turn of the 20th century, actually proved out many of those lifestyle secrets that we espouse in our little book, 35 Days to Good Health, and also in our seminars and things. That's
So I was trying to explain that. So when I got the vaccine and I felt fluish, I considered that feeling bad, but I did all right. After day 2, I was fine. I took some naproxen, but I had muscle pain and flu type symptoms. So.
But it only lasted how long? A day or two?
A day.
A day. That's fantastic. Now, I've been trying to get to the lifestyle thing. I'm gonna end on that. Here are the various areas of lifestyle. And this absolutely relate back to the Adventist Lifestyle Study 1. And the Adventist Lifestyle Study 1, and folks who are interested can go on and look at the results, because it was noted in all of the major journals, medical journals, and so on. So it's all factual information. And that is that the various degrees of improvement in what you eat. And you can start as low as eating kosher and parve, and then you can keep working your way up. And apparently, the closer you get to the top end of this, the longer your lifestyle is going to be, your life mortality, your living, your better quality of life, all of those things are going to go. So here we start this and say, you go to, okay, I'm going to eat all kind of animal products and just everything, then you're going to have the least life expectancy. And that's what the studies show. If you eat animal foods that we would call the birds, like chicken, turkey, your improvement is indicated by years in the study, but just a few years. And then we call vegetarian, have no red meat altogether. They're flexitarians that are getting closer to more plant-based, but they eat a little bit of a meat occasionally. Then you have your pescatarians, who are fish, but no red meat. Improvement in years. And we can invite more experts in later on to cover how many years. But then the farther up you go, the vegetarians, the ones that are plant-based foods, but yet eat eggs, milk, and cheese, they're up to about somewhere around 7 years or so, or maybe a little bit more. But the highest, longest living folks are what we call the vegans, and they are plant-based only. Now, you all know that I am a vegan, and I sure hope to live to 100. I don't know if I can make it, but that's what I want to do. And Dr. Ince, what are you?
Oh, I'm a lacto-ovo vegetarian.
So you're way up on the scale.
Yeah, but I mean, we don't know what the second Advent Health studies will finally show. One article that I did showed that the fish eating people were doing pretty well as well.
Yes.
And Bernard, I would like to emphasize that The other people in the other blue zones, like in Japan and Italy, Costa Rica, they're not all vegan vegetarians. A lot of them eat meat. A lot of them eat not the red meats, but fish, and have a little wine here or there. So they're not vegan. Most of them are not vegan,
Yes. Yes.
and they live past 100 and really good quality of life too.
Yes. And so when we look at those studies, we see also commonality in things such as get exercise,
And
uh,
spirituality, social connection,
spirituality, sunshine,
all
right?
that. Yes.
All of these elements working together, which improve the health and so on. I mean, this has been an absolutely fantastic discussion. And I can't thank you all enough for keeping us inside the guidelines of science and what has been revealed to us. Is there anything you all would like to say individually? Dr. Ince, would you like to just wrap up and say anything as we close up our conversation today? And we're going to come back and talk some more.
Okay. Well, if I had to write a prescription for just one thing for a healthy lifestyle, it would be exercise.
Wow.
Exercise is very important. It's important for your mind and just about every organ of your body that you can think of. So.
Excellent. Dr. Patty, you have anything last words for us as we close up for today?
Yes, I do. I don't want our listeners to get discouraged if they feel that they just can't be a vegan, or they just can't, give up all their meat. I don't want them to be discouraged that Rome wasn't built in a day. Do the best they can and limit, the amount of meat that they eat, and eventually maybe they can limit it to a certain extent that they're having it once a month or so. Because we found in the Advent Health Study that people that rarely, which means that they ate meat uh, once a month, had the same level of protection than those who didn't eat it at all. So eating it rarely is also a benefit.
So that brings in that point of moderation.
Moderation.
Moderation is a part of that whole thing of long living and good quality life and such. You
That's
know,
what the Blue Zone people have shown us. That
yes,
is moderation in everything.
isn't that
Even moderation in eating vegetarian catalogs and eating vegetarian foods. If you just, knock yourself out and eat all those processed vegetarian foods, that's not good for you either.
great?
Okay. So
Very good.
moderation in all things, and to strive to get to live a healthier lifestyle, and don't give up if you slip here and there. Just keep hanging in there and doing better every day.
Yes, that. Thank you so much. Now, we're taking a little just this as we close up. We're taking a little survey of the uh, people that we're interviewing, and it's very interesting. We are gathering the facts. We want to see also for our own little study here, not very scientific, but it's basic information. It's a questionnaire that they're answering and they're telling us. And so far, we have just two of our centenarians who have responded, and both of them are vegetarians. One of them is a vegan, and the other eats eggs and milk along with vegetarian products. They also apparently are very much into exercise, sunshine, going to church, and being with fellow believers. Those are all things that we're seeing so far. We'll see whether or not these facts hold up as we go down the line. Well, thank you so much, ladies, for being with us today. We're going to end today's podcast, but next week we will be having a special interview with Dr. Eugene Rogers, who is 104 years old. And he's living an absolutely incredible long life with good quality. And I just can't wait to have this interview with him. I know him also, I have a special relationship over many, many years. I've known him for many years, and it's such a privilege. And I look forward to it as we have our next interview. And thank you very much to all of our listeners. And we ask you to subscribe and pass the word and let folks know what we're doing here. Thank you very much, ladies. Have a good day.
You too.
Bye.
Bye
Bye.
now. Nice meeting you, Dr. Ince.
That's nice to meet you. Nice to meet you, Dr. Harry. Bye.